Orders of the day.
Ballot item number 65, private member's notice of motion number 62. Ms. Armstrong.
The member from London Fanshawe.
I move that, in the opinion of this House, the Minister of Health and Long-Term Care should immediately broaden the scope of public inquiry into the safety and security of residents in long-term care home system to include the following: safety of residents and staff, quality of care, funding levels, staffing levels and staffing practices, regulation, enforcement and inspections, capacity, availability and accessibility in all regions, the impact for-profit privatization on care, and government action and inaction on previous recommendations to improve the long-term care homes system.
Ms. Armstrong has moved private member's notice motion number 62. Pursuant to Standing Order 98, the member has 12 minutes for a presentation.
Good afternoon. I'd like to begin by acknowledging and thanking all the people who drove here this morning from Hamilton, Toronto area, London and Sudbury to support this motion to expand the public inquiry into the safety and security of the residents in long-term care home system. This motion is so important to residents in long-term care across Ontario and their families, as well as hard-working frontline workers who take care of them day in and day out. We need to be able to trust that our aging parents and grandparents can get the care they need and live in dignity and comfort and safety. Long-term care has been pushed to the breaking point by years of Conservatives and Liberal cuts, underfunding and understaffing. It doesn't have to be this way. We can fix the seniors' care crisis in Ontario. I am moving this motion today to expand the mandate of the public inquiry into the safety and security of long-term care residents. The first step to fixing seniors' care is to take an honest look at the problems today. We all agree that the public inquiry into long-term care must look into the horrific murders in Woodstock and London. The families, the loved ones of the victims deserve those answers. And every Ontarian deserves to know if there were warning signs that were missed and lessons that can be learned to ensure that this barbarity never happens again. But the government cannot stop there. The public inquiry must take a hard look at the systemic problems throughout the long-term care system. There were 8 murders that took place, and we have identified 8 aspects of the system that we must examine. We are calling on the government and the Ministry of Health and Long-Term Care to expand the mandate of the public inquiry to address the systemic problems in the long-term care homes, and I mentioned, and I'll read them again, to include the safety of residents and staff, staffing levels and staffing practices, capacity, availability, accessibility in all regions, funding levels, the impact for profit and privatization on care, regulation and enforcement and inspections, government's actions and inactions on previous recommendations, the quality of care that residents receive. I want to address each of these issues in the time that I have left. The safety of residents and staff in long-term care homes continues to be a worsening problem for under-resourced homes. Violence is an escalating issue, and that is why the Ontario Health Coalition has been so vocal about the need for a public inquiry. We must look at the causes of resident-on-resident violence. If the staff and residents can't feel safe in the home, everyone loses confidence in the system. Families have even resorted to placing nanny cams in their rooms. Tammy Corbino told us about her 86-year-old father, James Acker, who was brutally beaten and sexually assaulted for a period of 6 months. The violence her father experienced was so severe that he was transferred to a hospital, and the family was told they would have to wait up to 6 weeks for another long-term care bed. Because of the trauma they all suffered, Tammy began searching for long-term care homes in the area to evaluate them for safety. While waiting for a new home, her father succumbed to his injuries and died. These experiences are devastating and leave long-lasting scars in families. To this day, Tammy continues to advocate for the safety of residents in long-term care homes. We need a thorough investigation into staffing levels and practices. Long before the investigation into the heinous murders, nurses were reporting high levels of stress and demoralization. The Registered Nurses Association of Ontario recently conducted a research study of 734 nurses. The study found that on average, each nurse was caring for 36 residents at one time. It's no wonder residents in care homes are often left without being bathed or toileted. Frontline workers are simply run off their feet. They're stretched too thin. Care homes are so understaffed that workers are not in the position to deliver the quality of care to residents that they so want to do. The next term we need to acknowledge is capacity, availability, and accessibility in all regions. Parents and grandparents with debilitating health problems are often left languishing on wait lists for months or even years while their condition worsens and their families are left to bear the burden. With approximately 78,000 long-term care beds in Ontario and more than 30,000 people on wait lists, it's clear this issue is a major systemic problem in the long-term care system. Peggy Clark's mother was diagnosed with vascular dementia and Alzheimer's in 2011. After placing her mother on 4 wait lists for a long-term care home, Peggy became her primary caregiver. Although her mother needed constant supervision, the only help Peggy received was a 1 hour per day via the Community Care Access Centre. As her mother's conditions worsened, Peggy was forced to hire outside help 3 times a week out of her mother's small pension. By the time Peggy's mom was offered a spot nearly a year later, her condition had deteriorated to the point that she was tearing apart her room without any memory of doing this. In the context of this problem with worsening wait lists, I met with workers from Meadow Park in London, where the home's for-profit owner is proposing transferring 46 long-term care beds out of London. In an urban centre with a growing population of seniors, this is unthinkable, yet it isn't an isolated incident. Many of these core issues in long-term care cannot be resolved without examining the current funding model. It only stands to reason that as our population ages, we must allocate more resources to the long-term care system. Carol Saxby from London moved her mother, who suffers from dementia, into a long-term care home in 2010. Over the 7 years, Carol watched her mother's condition worsen as the amount of direct care she receives steadily declines. Carol has seen personal support workers' times divided by residents with increasing complex health issues. In 2015, the Auditor General reports long-term care home administrators identified insufficient staffing and training as a major issue. Carol's first-hand experience exemplifies the dire need for funding levels to be reviewed and prioritized by Ontario's next government, and I hope that's going to be the NDP. The primary motive for long-term care systems should be not cutting corners and earning a profit at the expense of the health and dignity of our seniors. Hiring and keeping staff part-time to maximize profits is demoralizing to the workforce and deprives residents of continuity of care. When the care home hires temp staff agencies to staff long-term care facilities, it shouldn't come as any surprise that there is such a high turnover of personal support care workers. PSWs taking care of seniors with increasingly complex needs and challenging health problems deserve to be paid properly. Prioritizing, thank you, the health and dignity of seniors over profit is a central component to solving the crisis in the long-term care system. Families in Ontario deserve the confidence of knowing that the care facilities where their loved ones are being looked after are governed by regulations that ensure safety and dignity. Minimum frontline staff to resident ratios, minimum standards of direct care hours per resident per day, and funding that ensures nutritional needs are met are all regulations that need to be established. Ensuring that both impromptu and scheduled inspections occur and that they are consistent and thorough is essential to prevent critical incidences. Making sure that all incidents that do take place are reported and impartially investigated ensures that the sort of accountabilities that gives families confidence in long-term care across the province. There must be serious consequences for regulatory violators. They need to know that when families speak up respectfully for improvements in their care, that there will be no reprisals against them, and that their families won't be subject to arbitrary no trespass orders or other silencing tactics. Despite multiple reports in signaling a crisis in the long-term care system that includes the 2008 Sharkey report, the Long-Term Care Task Force report, and the Chief Coroner's Office that called for increased support and resources into care homes across the province, the government has repeatedly failed to implement these recommendations. The needs of the long-term care population are changing as more residents require staff-intensive complex care, and the number of seniors requiring care increases. The government's inaction on previous recommendations to improve the long-term care system has contributed to crisis faced in the care homes across Ontario. Speaker, the quality of care. Hard-working frontline staff want to deliver the best care for our seniors, but they are coping with unmanageable workloads and often are not receiving adequate resources from the government that has turned a blind eye to Ontario's aging population. Quality care comes down to good relationships between staff and residents. Nurses and personal support workers want to develop and nurture relationships with residents, but when the average worker has 17 minutes per shift to attend to each resident, or nurses have 36 patients to oversee, there isn't enough time for even a quick hello. When the majority of staff are part-time or when temporary staff are widely utilized, community care is jeopardized, and that's when quality of care suffers. People are here today, and thousands more are calling on this government to implement and follow through with the second phase of the public inquiry into the safety and security of residents in long-term care homes system, and it goes beyond the actions of one criminal. In order to repair our broken system, we must root out the systemic issues that contribute to its problems. This motion is not only important to residents in care homes across the province, our seniors who are among the most vulnerable, but to the families, loved ones, and the hard-working frontline workers who take care of them every day, day in and day out. Speaker, I hope when we're debating this motion today, we'll remember that this government not only has called a public inquiry into the investigation of the heinous murders, but they have an obligation and a duty and due diligence to call a mandate and have Justice Gillies expand her scope into this inquiry and do the right thing and look at the systemic issues and problems that are contributing to the issues that families today are experiencing with their loved ones in long-term care. Thank you, Speaker.
Thank you. Thank you. Further debate.